Welcome to Western Wisconsin Journal. I'm Meg Heaton, and I've lived in Hudson for about 30 years now. And most of that time I've worked as a reporter for the Hudson Star-Observer. But I recently retired and have become involved in an initiative to make our community dementia-friendly. This program is one of several we are presenting to talk about what it's like living with dementia and what resources are available to help families and friends living with this disease. Just like cancer, it's likely that every family will be touched by the disease of dementia. And like the early days in cancer treatment, there's often a lot of stigma associated with it, and fear and confusion about what to do next. But that is changing, in part because of people like my guest tonight. My guest for this program is Jennifer O'Neill. She's an attorney and the owner of O'Neill Elder Law in Hudson. She's a certified elder law attorney who's licensed to both practice in Wisconsin and Minnesota. And she focuses on elder law, estate planning, trust administration, and probate. She is a graduate of the University of at Madison and the William Mitchell School of Law. And she serves on the State Bar of Wisconsin's Elder Law section as an advisor and is the chair-elect of the Wisconsin chapter of the National Academy of Elder Law Attorneys, which makes her pretty much our expert. Jennifer, thank you very much for joining us.
Thank you for having me.
In the information that you sent me for this interview, you started out with the question, how can I prepare for dementia? Let's start there.
Okay. Like you said, it's very likely that all of us are going to be touched by dementia of some kind, whether it be a family member, a friend, a spouse, a sibling, or maybe even ourselves. There's no special way to prepare specifically for dementia, but it all comes together with preparing for your life as we're all going to live it.
Mm-hmm.
And so what I tell clients is some of the most valuable documents that you can use, because I'm a lawyer, we have to talk about legal issues, are powers of attorney. And the reason that those can be so valuable with dementia is because you're sharing your legal authority with somebody else to help you with finance and personal business and then health care. And so those who are struggling with dementia are going to need those pieces of authority sooner, perhaps more than anybody else who isn't touched by dementia.
Can you talk about what a power of attorney actually does? There's words like durable, and which means others aren't so useful, or what?
Durable means that it bounces, right?
Yeah.
So durable, a lot of times when you hear the word durable with a power of attorney, you're really referring to a power of attorney for property and finance. That's just kind of how the document developed. What the word durable actually means is that the document will continue in effect if the principal, the person who signed the document, becomes incapacitated. So that means that they aren't able to make their own either healthcare decisions or their own financial decisions. So when you're executing powers of attorney for the purpose of allowing authority in the event of dementia, you absolutely want them to be durable.
Sure.
And for the most part, powers of attorney that you're preparing for estate planning purposes are going to be durable, because the attorneys that are doing that, or the documents that are available to the public, are durable. So two kinds of powers of attorney.
Okay.
And powers of attorney are always written documents, and they're signed by competent adults. So the adult part is easy, 18.
Right.
Competent, it doesn't mean that you have to be a rocket scientist. It doesn't mean that you have to be on top of your game. So what that does mean is if you're experiencing a decline, if a loved one is experiencing a decline, doesn't mean it's too late to execute a power of attorney. It just means that it's a little more urgent than it might be if you weren't having health or cognitive issues. So voluntary document. Nobody can force you to sign a power of attorney. It always has to be something you do of your own free will. Written document signed by a competent adult, and you're sharing your legal authority with somebody else. So you're not giving up your own authority to deal with your own personal finance, not giving up your authority to make your health care decisions. You're just sharing that with somebody that you trust, somebody that will accept that responsibility on your behalf.
And that's a misunderstanding sometimes. People think if they sign it, I can't control my own life anymore.
Yep, they think they're signing something away.
And they're really not.
Exactly. And that's why it's so valuable, because as long as they are able and willing to make their own decisions, they can. And not only can they make their own decisions, but if they discover that their agent, the person that they're appointing with the document, isn't acting in their own in the principal's best interest, or isn't doing what the principal would like them to do, they can revoke it. So the documents can be revoked. So you sign the document and it lasts until you revoke it or until you die. And remember, because you're sharing your legal authority with somebody else, your legal authority ends when you die, and so does the legal authority of your agent. So another misunderstanding is that somehow powers of attorney carry on after the death, and that's not true, and that can be frustrating for families.
Because a power of attorney is not the same as an executor of an estate or anything, right?
Right.
Okay.
They're both fiduciaries. They're both individuals that have legal authority to care for assets of somebody else, but the authority comes from a different place.
So when you're deciding to do, I mean, is it your recommendation kind of that when you hit my age or in your 60s, or as you're approaching your retirement or whatever, that you should be thinking about these documents right away, right?
Yes.
I mean, you should.
Ideally, you would start thinking about powers of attorney as soon as you turn 18. That's a little easier said than done, but as you're approaching, middle age, because
you never know.
You never know, and the likelihood that you're going to be hit with some kind of illness, some kind of injury, just increases. I don't know what the statistic is. Mortality is 100%. We're all going to die. It's just not a guarantee that we're going to all be competent until that day comes.
What do you tell clients is important in choosing that person that you're going to share your
In choosing your agent, I remind them that they're giving this person a job. That your agent should always, whether it's healthcare or whether it's finance, that person should always be somebody you trust. On powers of attorney for finance, think about the work that they're going to have to do. That one, you trust them. Two, it should be somebody that has some common sense, maybe has some ability with paperwork, because a lot of it's just paperwork. It's paying bills, filling out documents. So common sense is a good quality to have. Third, organizational skills, because you want them to keep your assets separate from their assets, your account separate from their accounts. So think about what you're asking them to do and pick the person that has those skills. And there might be one person that really jumps out as the ideal person. There might be several if you're lucky. There might be people who, maybe together. So in Wisconsin, we have the ability to appoint more than one agent for finance, so that's a possibility as well. Power of attorney for health care, again, you need to be able to trust them, but then think about that this is a very different job. They aren't taking care of money and finances, they're taking care of you. So trust, always. Second, they need to understand and support your healthcare philosophy, because you're asking them to make healthcare decisions that you would want if you can't make those decisions yourself. So understand and support your own healthcare philosophy. Also, be able to make a difficult decision. You're putting this person in the position that they may have to decide when it's time for you to go to a long-term care facility. That it might be time to stop treatment for a condition. The old saying, pull the plug.
Right, yes.
So you're putting them in a position where they may have to make a decision that it's time to pull the plug. So think about, the people in your circle that would be maybe not comfortable, but able to make that decision. Yeah.
And that you can communicate those wishes to very clearly, what you want.
Absolutely. Conversation.
Is all the communications. Are they ever the same person for a power of attorney and the medical?
They can be.
Is there one way that's better? It just depends?
No. It depends. Classic legal answer, it depends. If you have one person and they have the job skills to do both, there's no reason that they can't. People, parents especially worry about kind of spreading the work around, spreading the love around. They're worried that somebody's going to feel left out. Remember that you're giving this agent work.
Yeah.
And so it may be an honor for maybe the first 10 seconds, and then after that it's work.
Because they're not compensated jobs generally, right?
Not generally. Generally, it's voluntary. In my documents, I do allow my agents to be paid because you never want it to be a financial burden
to them.
for your agent to serve. But for the most part, we don't expect that there's going to be compensation. Again, it depends.
And oftentimes, when you mention the medical too, it's not just a question of pulling the plug, but that decision to go into long-term care or to go into a memory care unit or whatever, that can be one of a really tough one, I would imagine.
It's incredibly tough because, you know, in our culture, in our society, we want to stay home. And the trend these days is to provide care at home. People are generally more comfortable at home. We perceive that there's a higher quality of life at home. That's not always the case. Sometimes when people are at home, they're a little more isolated. Maybe they can't get the care that they need in their home, and so it makes sense to move them to a facility. What's interesting about Wisconsin is Wisconsin has some very strong patient protection rules. And so in Wisconsin, it's very, very important to have a power of attorney for health care authorizing your agent to admit you to a nursing home or to a community-based residential facility, which is a little higher level of assisted living. And the reason for that is in Wisconsin, you can only be admitted to those facilities basically under 3 conditions. 1, if you're competent to admit yourself. 2, if you're not competent to admit yourself, you need to have a power of attorney for health care specifically authorizing your agent to admit you. Or 3, if you don't have a power of attorney and you're not competent, we have to pursue a guardianship action. And so just from common sense, kind of a ease of use, ease of transition, it's valuable to have a power of attorney for health care that specifically authorizes your agent to admit you. And that's something that's a little unique to Wisconsin. We don't see the same. We don't have the same rules in Minnesota. And so for all of us in the border area that get a lot of health care in Minnesota, we might have powers of attorney for health care from a Minnesota facility that doesn't have the right language. So you have to be a little careful.
Okay. What other kinds of the power of attorney and the medical power of attorney, but what other kinds of things do you tell people when they come in the door that they need to look at?
My big push for my clients is to understand their options. You know, we look at estate planning options and different processes and different tools. And then when we're looking specifically at long-term care, you know, not only do you need to have those powers of attorney to make sure that somebody has authority to manage personal business and make healthcare decisions, you also want to look at what are your placement options, kind of what are the advantages and disadvantages to home health care, to assisted living, to memory care, nursing home. And then we always have to talk about how is that going to be paid for, because that's the other big fear, that's the other big struggle when you're dealing with dementia. You've got the care component and making sure that your loved one gets appropriate quality care. And maybe when it's time to bring in a professional or move them to a facility, then you're afraid of how are we going to pay for it. And so everybody has options. There might not be a lot of options, but everybody has options, and sometimes just understanding what your choices are, what your options are, somehow makes it more manageable, and it helps the family focus on what's really possible and what's really probable and helps them move forward a little bit.
Do people's when people come in to see you, what do you talk about in terms of their assets and what they have and their homes and that kind of thing?
I go through their entire list of assets. You know, planning always depends on 2 factors: family and assets, because that drives a lot of the possibilities and a lot of the decisions. So when you're looking at paying for long-term care, you have to have a full picture of their assets, from real estate, bank assets, retirement assets, investments, even down to vehicles and funeral plans. So we get pretty comprehensive when we're talking about assets.
Are you finding that in terms, you deal with a lot of clients who are dealing with dementia or early onset. It's different for people with early onset than people who are Older or not? Are there same issues?
It's the same issues. Some of it's generational. Realize that the way that we hold our wealth now is different than the way that we did, our investing 50 years ago. We didn't have IRAs, 401ks, 403bs 50 years ago. So with those generations, you don't see those retirement assets. You might see bank accounts or investment accounts or real estate. So those issues change, but the planning is still the same. Whether you're early onset, so younger and needing long-term care, or older generations needing long-term care, it's consistent.
Where do wills and all that fit into all this?
Wills are documents that only kick in after you die.
Okay, so they're not.
They're a part of estate planning, but they're really not necessarily part of long-term care planning.
Okay.
And in my practice, I differentiate a little bit. It's hard for me to talk about estate planning without thinking about long-term care planning, or long-term care planning without thinking about estate planning. But wills are written documents that only apply after you die. And so we may certainly be talking about wills as part of the overall plan. But they aren't technically part of long-term care planning.
Okay. Are there things when you talk to clients that are specific that you address with caregivers who may or may not be the power of attorney or whatever, but caregiving?
Well, one thing that I always recognize and that I always want the family to recognize and appreciate is caregiving is hard. And so I talk a lot about the concept of caregiver fatigue. It's almost universal that we'll have one or two of those caregiver children, and sometimes all the kids pitch in, which is wonderful. It can be a little chaotic figuring out who's doing what, but so much of the time it really kind of shrinks down to one or two caregiver child. Tends to be daughters for some reason. Women are more nurturing. Often, or maybe the oldest or the youngest. So I always talk about caregiver fatigue and be careful of that. We're so busy focusing on the individual with the dementia or with the illness that we forget to look around the table and make sure everybody else is doing okay. So that's what I focus on specifically with the caregivers, helping them recognize what their limitations might be, what their choices are. Because there's a lot of guilt,
yes,
a lot of guilt with caregiving, and I think we're doing better at that.
Yeah. In some situations, I would imagine that families or caregivers, children, come to the realization that their parent needs help before the parent does, or the parent resists it, or they're in denial. How do you help families navigate that?
That's a little bit sensitive because in my practice, the parents are the clients.
They're your
almost always.
Okay.
But like you said, they don't always know what's good for them. They don't always recognize their limitations, or it may be pride, it may be independence, it may be privacy. So what I can do for the kids is educate them about options so that they know about powers of attorney, they know about trusts, they know about wills and how those all fit together, they know about payment options for long-term care, so that they can go back and talk to their parents and maybe start the conversation, open up the issue and say, hey, did you know that there are things that we can do? Or if you executed these documents, that would make it easier for us. When a lot of times when you approach the parents and say, this will help your kids,
then they're open to it.
Then they're open to it. That they're a little bit scared. They may be a little embarrassed that they don't understand this stuff. I get a lot of people who apologize that they don't understand long-term care plan. Why would you?
Right.
I hope you never have to go through this until you have to go through this.
Right.
And that you don't have to go through it more than once or twice. So nobody other than us elder law attorneys should get to be an expert at this. We really hope you don't.
Other than yourself, what other kinds of resources do you tell your clients about that they should look at?
I always talk to them about the Aging and Disability Resource Centers in Wisconsin.
Yeah.
Every county has an Aging and Disability Resource Center at the county government center or the county office buildings, ADRC for short, and they have free services. So not only for the aging community, but also for the disabled community. They're wonderful resources, wonderful, wonderful resources. Elder law attorneys, estate planning attorneys, there are other nonprofits, ARC. The ARC is becoming more active here in western Wisconsin. You know, Google it.
Right.
You can get a lot of good basic information online. It's hard sometimes to put all the pieces together with what you find online, but it gives you a good base and helps you kind of hit the high points.
Sure.
So yeah, even online is valuable.
Does dementia qualify as a disability?
I don't know if it qualifies as a disability under,
Like
you know,
Social Security or something
well,
like
under
that?
Social Security it would. So, but realize that when you're looking at government benefits, it's usually elderly, blind, or disabled. So as soon as we each turn 65, we're officially elderly. So you fall into that category for Medicare, for Social Security. Well, not disability benefits. That would be before age 65. But perhaps housing benefits, medical assistance benefits, food share benefits.
So you could use some of that possibly.
Yep.
Okay. Based on what's the biggest challenge that you think your clients and their families face when they're dealing with dementia when it comes to the legal and financial matters?
The biggest challenge is always authority. That's where those powers of attorney come in. I explain, you know, with powers of attorney for finance, good comprehensive powers of attorney for finance, what you're doing is you're preserving your options. Lots of families come in and they're like, but what if this happens? And what if that happens? And what if that? And all those what ifs. And we can't predict the future.
Right.
You know, sometimes there are diagnoses and there are just conditions that, yeah, we can kind of see where this is going, but so much of the time we're guessing. And so when we're trying to make decisions, we want to maintain some flexibility. So having, you know, what I call good powers of attorney for finance can be really valuable because it preserves options to create a trust if we need a trust in the future, or transfer assets, or do a marital property agreement, or change beneficiaries. So it preserves the individual's ability through their agent to change their planning, move their assets around. So authority is the big one, and the other challenge is just understanding what your options are.
Right. What's the biggest misconception that you find your clients have?
Regarding long-term care, one big misconception is that Medicare pays for everything.
Yeah, that is a big one. And explain that a little bit about how that works.
So Medicare itself is a federal health care program that we each receive when we turn 65. If you're determined to be disabled younger than age 65, you can access Medicare 2 years after you're determined to be disabled. Medicare has really 4 pieces. Part A pays for hospital costs. Part B pays for doctor's visits. Part C is kind of the advantage plans, and Part D is the drug plans. Those all have their limitations. You notice when I was going through, really none of those apply to long-term care.
Do
and
they?
So when I say long-term care, nursing home, assisted living, home health care. And a lot of people believe, partially because of the name of the program and just kind of what they think they've seen or heard, they think that Medicare has more long-term care coverage benefit than it really does.
And it really doesn't cover that.
It has a tiny little conditional long-term care benefit. So there are 5 ways to pay for care. One of those ways is Medicare. But to qualify for that coverage, the individual first has to be in a hospital as an inpatient for 3 overnights and then discharged to a long-term care facility or rehab facility for rehab. If those primary conditions are met, then Medicare should pay for 100% of the cost of their rehab care, including the facility, for the first 20 days. Now there are conditions on that as well.
Yeah.
They have to be getting therapy at least 5 days a week. They have to be getting some kind of positive impact from that therapy. Now notice I didn't say they have to be improving. They have to be getting some kind of positive impact, either improving or maintaining their functioning level. And that's something that's a little bit fuzzy even with the facilities themselves. But if you're getting that positive benefit, Medicare pays in full the first 20 days. On day 21, if you're still in the facility, still getting the therapy, still getting a positive impact, you pay a copay, and it's a pretty hefty copay. It's about $164.50 this year, $164.50 a day, and then you pay the rest, or your Medicare supplement insurance will pay the rest. That goes up to 100 days. So people have heard of the 100 days or the different time periods for Medicare. They don't realize all the conditions that have to be in place before that coverage exists. But yeah, it's a tiny piece, and in the right circumstances, it's wonderful coverage. You can do a lot of recovery. You can do a lot of good in those first essentially 3 weeks in a rehab facility.
Even with dementia, or even if the diagnosis is that or whatever, right?
Well, remember you have to have those 3 nights in the hospital. So dementia usually isn't the diagnosis. It might be a piece of it. Usually it's an injury, maybe a fall or an illness or some kind of health issue, a stroke or a heart attack or something. But hospitals today, they don't like to keep you for very long. So to stay in the hospital for 3 nights, there's significant, health issue going on there. And so there's something more than just the dementia.
Sure.
It's not just, gosh, we've come over to mom and dad's for Thanksgiving and realize they're really struggling. You can't hospitalize them for that.
No.
And if they're not hospitalized, they aren't going to have the Medicare coverage.
When you talk about the long-term care facility, whether you're looking for something specific because of dementia or just because they need help or you can't live on your own any longer, do you have any recommendations as to what people should look for in terms of evaluating or finding the best spot for their loved one to be in?
You have to look at what your priorities are. Sometimes it's really important for the family to keep their loved one in the community.
In the community where they live.
Sometimes it's the level of care that they need. We really want mom in a memory care unit. That's going to be the most suitable for her. Sometimes, gosh, in a pinch, you're just looking for something appropriate with an opening.
Yeah.
We're really lucky in western Wisconsin that we have really wonderful long-term care facilities. Realize that no matter what, even the best facilities are still institutional care.
Right.
So they aren't going to be like home, but that might be a good thing. Lots of socialization opportunities, good consistent scheduling with meals, with activities, with medications, relieving the caregiver of the caregiver role and letting them go back to being a spouse, letting them go back to being a child, not a child, but daughter or son, rather than the one giving the medications or providing the bathing help. So you're looking at level of care, and the facility is going to look at that too. They need to make sure that somebody coming in, that they can provide the right services to them. But in terms of quality,
that's subjective.
You're right. That's subjective, and part of it is what else is going on. I've had families come in and say, we really want to return mom to the town where her siblings are. And so the location is just as valuable as the level of care, just as valuable as the quality. There's lots of regulations around long-term care, and you have to trust that those regulations are providing a minimum standard of care. I also tell families that if you're worried about the quality of care that your loved one is receiving, spend time.
Yeah.
That if they know that
you're gonna be there every day,
daughter's going to be there, they might give mom just a little extra attention. again, caregiving, even if it's at home or if it's in a facility, it's hard. And patience.
Sure.
Patience and realizing that they're taking care of not just your loved one, but the loved ones of lots of other people as well.
Just in listening to you talk, a lot of what you do, you have to kind of do the social work part of it or whatever, as well as the law part as well. You're advising people in a very sensitive time in their lives, trying to get them into the best place they can be. Is that a particular challenge? What brought you to elder law? Is that something you really like doing, or what?
I really like working with people. It's an incredibly satisfying area of practice. Most of my clients, when they leave, they hug me. And
people hug their lawyer, huh? That's
yeah,
good.
They do. And I hug them right back. So I think elder law as a practice area draws in those of us who have a little sensitivity to that, have a little bit of extra care and attention. I think people who aren't comfortable with this interpersonal kind of relationship and communication wouldn't be drawn to elder law, which is fine. There's lots of other areas of law that we need good practitioners. And so, yeah, it's very holistic.
Sure.
Which I love. And I find that most elder law attorneys, we all do it because we love it.
Well, and you do deal intergenerationally too, because you're talking about not only your clients, but their families and their caregivers or their powers of attorney or whatever.
Yep.
Yeah.
Yeah.
Have you seen a big change over the last, how many years have you been practicing law?
I have been practicing almost 24 years.
Okay. And what's the biggest changes you're seeing in your clients or in the practice?
I'm seeing that clients and their families are actually seeking out elder law attorneys. That when I graduated from law school, elder law was not a practice area in the Midwest. And so it's grown and it's become more recognized, and there are clients who are seeking out that area of expertise. And there are attorneys who are coming to the practice of elder law because of that holistic approach. And so that's the biggest change I've seen, is just the growth and the recognition about how special it is, how valuable it is.
Oh, yeah. Well, I know just from the interviews that we've done for this program with Darcy Strutt and Emily Smith, both caregivers at different points in their lives. One's a spouse, and one is a young woman who probably never thought she'd find herself in this position. And how important, they both mentioned how important the advice and the information they got from you was in navigating this. I think it's a real source of support.
Thanks.
And
it's gratifying and a little embarrassing.
Well,
but I'm happy.
You're
to hear
entitled
it.
to be embarrassed.
Thank you.
Anyway, is there anything else I haven't asked you about that you'd like to mention?
How long have you got? I mean, I can talk for a long time.
Well, I think we covered the high points of it, and I want to thank you for that. And I want to let people know that they certainly can contact your office and get more information. It sounds like it would be a good idea for all of us elderly now that I'm 65, right?
That's right.
Yes.
I tell people my clients are anybody who's going to grow older or anybody who's going to die.
Yeah. Gee, that kind of
narrows it right
that's
down.
A great pool to draw from. There are other resources, as Jennifer mentioned, across St. Croix County for families and individuals who are dealing with dementia. We've provided these information about these resources as part of this program. I also want to mention the Dementia Friendly Coalition, which is sponsored by the St. Croix Valley Foundation. They are also at work on efforts to make communities across our county dementia friendly. Information about the coalition is also provided here. And the programs in this series have included interviews, as I mentioned, with caregivers Darcy Strutt and Emily Smith, and St. Croix County dementia care specialist Nancy Abrahamson, as well as we have an upcoming interview with Dr. Kristen Severson, who specializes in geriatric medicine and the diagnosis and care of those with dementia. I want to again thank my guest, Jennifer O'Neill, for the valuable information she shared that I'm certain will be important to those families that are dealing with dementia. Thank you for watching.